Hi guys, welcome. Dr. David, if you can, when he comes on, I'll get his Instagram for you guys. Welcome guys, welcome back. I don't want you to miss anything, so I'm going to wait for the people to come back on, and then we're going to start again. I'm going to connect David in a second. Okay, cool. Just gonna wait for a couple more people to come on, and then we're gonna start. I don't want them to miss this. Guys, if you haven't already, I can't stress this enough. Share this right now. If you are sharing or have shared, please put shared in the comments. I need to see you sharing, please. Knowledge is power, guys. Knowledge is power. Come on. We need to learn today. If you have shared this already, please guys, please put in a comment you have shared. Welcome guys, welcome. Right, we're gonna get David back on now. Shared, thank you Anna, thank you for sharing. Guys, if you're sharing, I need you to share guys, come on. We need to share this, knowledge is power. We need to learn, because our society, we're struggling and we're going to be suffering in silence, and it's not fair. Why should we suffer in silence? Thank you, I am Simply Marion, for sharing. Keep sharing guys, people need to know what's going on. It's deep, man. It's making me, I'm getting a bit shook now, thinking about what he just said. I'm not even going to lie. Right, David. Up, where is he? Sorry, David, if you can request me one more time, so I missed the request. Just request again and I'll add you on, please. This is just amazing. Amali. This is amazing. Right, guys. Oh, where is he? Sorry, guys, I'm just getting David back on here. Guys, this is mad. Keep sharing, guys. Keep sharing. Come on. Keep sharing. I'm just a bit. Thank you, David.
Hello, thanks for having me back.
Thank you. Oh my God, David. So my question, I don't know if you can answer this. If you can't, it's fine. I'll probably ask Oliver or Ollie, because he's on the lupus side, because I have lupus, as you know. So when you mentioned the whole brain fog thing, and then you mentioned you can get dementia, that's obviously linked, isn't it?
So not necessarily. So actually, as I mentioned, because it's so general and actually quite unpredictable how the inflammation might happen, loads of people have different ways or different extents to which their brain gets affected, and it's more of a link or an association or increased risk rather than sort of a natural progression, if you see what I mean. So often when people get brain fog, it's kind of like, it's almost like a flare or like a subacute flare when they have sort of MS or SLE or whatever. So it's not necessarily sort of, you know, if someone's getting brain fog, for example, if someone's got MS, they're going to get dementia. It's more of a correlation or a link rather than a causation.
Wow, okay, because I'm not gonna lie, I was
scared you a bit there.
Listen, I'm not, sometimes I overthink, because with my lupus, it's lupus to the brain. So for me, anything to do with like brain fog or like dementia, I'm not gonna lie, I panic. I'm like, where, you know,
can be hard to take as well, but not to scare you there.
So it's not, no, but it's good for people to know, you know. So whoever's out there as well, they might have lupus to the brain. They might be thinking the same thing I'm thinking. You know, I know I'm not the only person. I'm not the only one. But obviously, you know, for what I do, and I've got a child. I don't want that to be, you know, on him. Do you know what I mean? It's a bit. It does worry me when I'm looking in the future, thinking of how would it be for my son to be, maybe the roles will reverse, where he's the one looking after me, and it's just, it's a bit,
Absolutely.
Yeah. Oh my God. Okay. So we've got another question from Natalie as well. She says, MS is a complex disease. Do you have any tips on how sufferer with young children explain to their children how the disease affects them? Interesting question.
Yeah. So that's a very good question. I guess that'll be really, really relevant for everyone as well. So yeah, it is really complex. It's quite varied as well. You know, the symptoms, as I was mentioning earlier, there are lots of them. But I guess a way of sort of describing it to a young one or someone who's not particularly sort of scientific or medically inclined is sort of explaining the basics of what's normally normal, as in how the body should normally work. So
Yeah.
often when we're trying to explain something to a patient, for example, we explain the normal instant how things should work. So in this case,
Yeah.
you can sort of explain that, you know, the body's got lots of ways in which it communicates from one part to the other. And
Yeah.
normally when someone gets an infection, you know, the body has an immune system that fights it, or basically has a way of preventing these infections from taking over. But in the case of MS, the body unfortunately turns on itself and starts to attack normal cells. And then when they get those attacks, you get these symptoms, and then you can describe the different symptoms that this person can have due to those attacks. And hopefully that should be able to clear things up a bit.
Wow. Okay. 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 She also asked as well. She said, my neurologist advises me to take my vitamin D supplements daily. What is the connection with MS and vitamin D? I did see people say that in the comments, but if you can kind of clarify that for me, please.
Yeah. So at the moment, they're not really sure exactly. So often when the way we learn things in medicine is initially it starts with an association. Then once
Okay.
you notice that, you know, so an association, for example, so we notice that, you know, more people who have less vitamin D have more likelihoods to have MS. So you're like, okay, right, we've got this association. Then you look for a biological explanation of why this is the case, because you need to have a biological plausibility. And there've been lots of sort of hypotheses out there, which obviously is still research is still going. Because the thing with MS and neurological conditions is we know very little about them, and there's always research to sort of inform us a bit more. But essentially, they suspect that vitamin D is really important for the upkeeping of these cells. So basically, the turnover of nerves. And they think that people who have less of it obviously are more susceptible to having attacks to it and aren't able to repair it quickly enough. So they end up having more scar tissue, and hence basically they don't have enough substrates to be able to cause a quicker repair. And that's what they think vitamin D. That's what they think the link between vitamin D is at the moment. But it's very tenuous, and they haven't had any sort of causation. So yeah.
Is there I don't know much about MS in terms of like medication and stuff. I mean, what else do they have to take, or is everyone at different stages? I don't under. Do you know what I mean? Like
So
when it
what
comes
was
to
that?
medication,
So
with medication,
yeah.
do they have to take medication for what they have, or
So
stages? Because I know with lupus there's like medium, mild, and high. Is that
yeah,
the same with
yeah.
MS?
Same with MS. So MS, actually, the way that MS is described is more sort of the progression of the symptoms, or the progression of the clinical state of the person. So there are different types of MS actually, and it's essentially sort of the most common one is what something called relapse remitting, which
Right.
basically is a fancy word for comes and goes. So often people will have symptoms, clusters of symptoms, which are separated in time and place. So
Mm-hmm.
an example, so I'll give you a classic example of a history that someone might present with MS, which is essentially they'd have symptoms of tingling in their hands, which they had constantly for about a day and a half, and then it went away. And then 2 months later, they started to have visual problems that went away. And then 3 weeks later, they started to have sort of urinary symptoms. So these are basically
Sorry, one
just
second.
different. That's right. So it's just different types of symptoms that they're having separated. And often what happens is that each time you get a hit, it kind of causes a decline, and then that causes rapid decline as you go along. So that's called the relapse and remitting. And then you've got the primary progressive, which is you get the symptoms, they never really get better, and then you steadily get worse and worse and worse. And then you got the secondary progressive, which is basically like the relapsing, coming and going, but it's more frequent, and the hits get worse and worse and worse as well. And essentially, as I mentioned earlier, no kind of treatment. So the main treatment at the moment, or the main sort of way to manage it, is to manage the symptoms and to reduce that inflammatory process that causes the symptoms to get worse and worse, or the disease process to get worse and worse. So some people, and the thing is, because it's so different for everyone, it's mainly based on a decision between the neurologist and the patient, and what the trade-off is and whether or not it's worth treating. So sometimes some people they have the main symptom they might have is sort of, pins and needles, and then you can just manage that with a drug called, drugs that target the neurons. So things like diazepam, etc., which are all prescription drugs. Or some people, the main problem will be muscle sort of stiffness. So you can give drugs like baclofen, which are muscle relaxants. Or people have urinary problems. So they might have like urinary incontinence, for example. So then you treat it with sort of other drugs that act on the bladder. Or people might have inflammation, general inflammation, which is really problematic. So then you give them medications that control the inflammation. So it's mainly kind of tailored to the symptoms that someone has. So not necessarily everyone with MS will go on medication, because they might have MS, but it's a sort of mild form of it. And, they can manage with sort of lifestyle changes, which they can make decisions with between them and the consultant who's looking after them.
Wow, thank you so much. I've learned a lot today, David. Honestly, I've learned so much.
Pleasure.
And I can see everyone is saying they've learned a lot, and it's been amazing having you on. And
thank you so much for having me.
It's just, I'm pretty sure we're going to need you again very soon. We might, I don't know what's happening. We might have a Q&A. We might do a Q&A, I think is going to happen. But that's been fantastic. God bless you with your talent. You're amazing.
Thank you so much
for coming on and taking your time. But thank you so much. Guys, if you can, please give David some love hearts. We appreciate him. Come on, just give him some love hearts, guys. David, thank you so much. Thank you so much.
Thank you so much. Thank you.
Take care, darling.
Bye-bye.
Thank you. Bye.
Bye.
Bye. Guys.